Welcome back. No profession is immune to the drug abuse epidemic, and that includes physicians. In fact, there is a program specifically formed to help physicians who have succumbed to substance abuse. It's called the West Virginia Medical Professionals Health Program. And joining me to talk about this issue is Dr. Brad Hall, Executive Medical Director of the program. Dr. Hall, thank you for being on the show.
Thank you for having me.
Can you tell us a little bit about what exactly is this program and what does it do?
Really good question. Up until 2007, West Virginia was one of 3 states that didn't have what we call a peer assistance program. They've been around for a while. The FAA uses them, nurses programs, pharmacists, lawyers, and we developed one for physicians, podiatrists, and physician assistants, licensees of both boards. And that allows these individuals when they're sick with a potentially impairing illness to come forward and be treated in a voluntary, confidential, respectful manner. It also encourages other individuals to bring those individuals forward if they need assistance and guidance. The model works. It has over a 90% success rate of being clean, sober, and working at the end of 5 years. The only thing that compares to that is the FAA.
Well, how big is the problem? I mean, I know that, people ask that question, and we know substance abuse is an issue across our country and in our state. How big is this problem in terms of with medical professionals?
In my work with the Federation of State Physician Health Programs, it's an issue in every state. It's not that the issue's gotten bigger, it's being better recognized through earlier detection, prevention, education, and these individuals are coming forward. It's actually a very small percentage of physicians. If you look at it like any other disease model, whether it's diabetes, cancer, mental illness, or addiction, they all have an incidence rate. The difference is these are people in safety-sensitive occupations. So the occurrence of those events, if untreated, can have catastrophic consequences, similar to a pilot who would be flying an airplane, potentially impaired from some type of substance use issue.
Now, I know many people ask the question, and I think it's a hard question to answer, but why is this occurring? I mean, what is, in particular with medical professionals, why do you think it's occurring? Is there some research out there that talks about that?
There is. People look at that information. I think the biggest reason is the human condition. They're not immune any more than anybody else is. But in particular, through their education, they're not trained how to ask for help, who to ask. And physicians don't listen real well when they do find out what to do. The training makes them very comfortable with powerful addictive substances. They're not really good at recognizing when they are sick, and if they are sick, they tend to keep going anyways. So it's just a population that's almost like an occupational hazard. And the life-work balance that occurs nowadays in the healthcare field and the stress that occurs along with it. A lot of these doctors have actually been self-medicating their own medical condition, emotional pain, physical pain, and they don't realize or they forget that these are very addictive substances. They're busy working, and the next thing they know, they got a problem.
Can you tell us a little bit about how the program works? I mean, how is this addressed with physicians? And I know that, the public, wants to be assured that there's safety for them
Right.
as physicians are working through this program.
They can access the program by volunteering to sign up. There is some protection of the records and confidentiality that's actually granted by the licensure boards. But they have to do what they're supposed to do to get well. Through a lot of education and integration with organized medicine, getting the word out that we're available for help. And once they sign up and they get help, they're with us for a period of years. It includes very good treatment and post-treatment monitoring and support that, for lack of a better way to put it, helps them stay between the white lines till they can keep themselves between the white lines. And the licensure boards actually recognize the program does its job. They grant anonymity on license renewals so that they can stay anonymous, provided that they're compliant with the program.
Well, I congratulate you because we know there's a shortage of physicians and medical providers in our state and in our country, and the fact that we're doing something to help our physicians, I think is critical, because when you're in a high-risk profession, we all know that it's important for us to be there to support each other and to help each other, and the way your program is set up, it does that. I know you do a lot of physician education. Can we talk a little bit about that?
Sure. I've given about 100 lectures over the last 7 years to medical societies, organized medicine, medical schools. Interestingly, about 20% of our doctors today are medical students and residents, so we're getting to them earlier in their career because of that education. We've got an addiction conference we put on. We're involved in some other events that we just sent out a statewide mailer to all the licensees of the state about the program. It also included a clinician's pocket guide to help them deal with their own patients. And through this education, what we figured out is for every doctor that we touch, he will go touch tens of thousands of lives differently with a better fundamental knowledge. As part of that education, the 3-hour CME is required for all licensed physicians now. I'm involved with the State Medical Association and having that updated on an annual basis to keep up with new things like the current statistics of overdose deaths and what difference we're making with pain and addiction and other topics, and most recently the naloxone issue that these physicians need to be aware of. So it's an ongoing issue, and I do a lot of education outside the state doing the same thing.
Well, thank you, Dr. Hall. I appreciate all the work that you've done, and I know you're a very valuable member of our Governor's Advisory Council on Substance Abuse as well, and I appreciate our collaboration and working together.
Thank you very much for having me.
When we come back, a look at how we as a state are addressing the behavioral health issues of our citizens. Plus, we'll hear from someone whose story of survival will shock and inspire you. We'll be back in a moment.